People need the ability to move to function. Some people rely on technology to help them move, but for many of us, we count on the musculoskeletal system. One of the prime treatment goals in physical therapy is to improve range of motion. To be able to determine if we have made progress, we need data. For joint motion, that data is collected using a goniometer. The goal for this video is to present concepts related to joint motion and to provide a foundation for goniometry. So let's jump in. Range of motion is a generic number. In order for that number to be significant, we need to understand whether it was achieved actively or passively. So, what's the difference between the two? With passive range of motion, all of the movement occurs as a result of an outside force on the part of the clinician. Passive range provides valuable information about the ability of the joint to move. Active range of motion occurs as a result of muscle contractions on the part of the patient. It provides much more valuable information with regards to function. Another valuable piece of information related to range of motion is joint end feel. It's defined as the type of resistance perceived by the clinician at the end of the range of motion. There are three basic types of end feel which would be considered normal. A soft end feel occurs when groups of muscles around a joint bump into each other, limiting further motion. A hard end feel occurs when further motion is limited by bone-on-bone contact. An example of this is elbow extension. A majority of joints have a firm end feel. During a firm end feel, motion gradually comes to a stop as the soft tissue surrounding the joint get tighter and tighter. End feel is used to help determine proper function of a joint. Frequently in physical therapy, we encounter situations where motion is not normal. We either have hypo, or below normal motion, or hyper, above normal motion. Hypermobility results when the structures surrounding the joint don't provide the proper stability. This can be congenital or it can happen as a result of trauma. In either case, motion usually exceeds the expected norms. On the opposite side is hypomobility or limited mobility. Hypomobility can result from changes to the articular surfaces or impairments to the soft tissue structures or muscles surrounding the joint. Thorough knowledge of anatomy is key in physical therapy, and goniometry is no different. The ability to reliably measure joint motion is only as good as the ability to properly identify and palpate bony landmarks on the skeletal system. Before attempting goniometry, significant time should be spent on identifying and learning the proper bony landmarks used for alignment. Using consistent, well-defined testing positions is a key component of providing accuracy across time or between clinicians. In addition, properly stabilizing the proximal segment ensures that we have range of motion measurements that don't include unwanted contributions. During measurement, it's also important to keep an eye out for patients who unknowingly cheat to try and improve their range of motion. When first learning goniometry, it's important that you don't focus so much on getting your measurement that you fail to identify compensations on the part of the patient and correct them. Failure to identify and correct these compensations will result in measurements that are not reliable. So let's go over the steps necessary to take a proper measurement. As with any procedure in physical therapy, the first step is to make sure you're safe to perform it. Once that's been done, you want to introduce yourself to your patient and explain the testing procedure. After getting patient consent, you want to place them in the proper standardized testing position. Next, be sure to properly stabilize the proximal segment. Before measuring active range of motion, it's important to establish the patient's passive range of motion and to assess what the end feel is like. Comparing passive range of motion to active range of motion helps determine if any limited mobility is related to impairments of the joint structures or impairments in strength. Next, we need to identify our bony landmarks used for alignment. the goniometer lined up, you can note the starting position, and then your patient may move through active range of motion. You should encourage the patient to move through as much active range of motion as possible without pain. When the patient has reached their limit, you want to make sure the goniometer is still properly aligned and record your measurement. When documenting your measurement, you want to be sure to include what joint was measured, which side of the body it was, and whether the motion was active or passive. As with any piece of data that we collect in physical therapy, we're always concerned with validity and reliability. The validity of a measurement refers to how well the measurement represents the true value of the variable of interest. In PT, it's generally accepted that as long as the person doing the measuring has a good knowledge of anatomy, is accurately identified and palpated the bony landmarks for alignment, and properly aligned their goniometer, that this measurement of range of motion can be considered valid. We are also concerned with the test's reliability. Reliability refers to the amount of consistency between successive measurements of the same variable under the same conditions. A number of studies have been done looking at the reliability of goniometry. Research has shown there's at least a 4 to 5 degree error in any goniometer measurement. This increases slightly when we talk about measurement between clinicians. With these margins of error, it's important to understand that when you're measuring range of motion, a change of 1 or 2 degrees may not be considered significant. Finally, when would you choose to measure active versus passive? Passive range of motion gives us valuable information about the health of a joint and how it's functioning. It's also useful when a patient is unable to move, or if there's a medical reason the patient shouldn't be actively contracting. While passive range of motion is a useful tool, active range of motion relates more to function. Documenting changes in active range of motion may be a much more useful tool when determining a patient's progress towards functional goals. So hopefully this video has provided a foundation for what goniometry is and how to properly perform the procedure. As with any skill, the key to proficiency is practice. Good luck with your goniometry.